Welcome to the Point Think channel. In this video, we will discuss mental health. Mental health refers to the health conditions related to a person's emotional, psychological, and mental state. It includes how a person thinks, feels, acts, makes decisions, and interacts with others. Mental health is very important as it can affect a person's quality of life and well-being. Some factors that affect mental health include 1. Genetic factors. Genetic factors contribute to the development of mental health disorders. Some studies show that mental disorders can be inherited in families. However, it is important to note that genetic factors are not the only cause of mental disorders, and environmental factors also play a significant role. Some mental disorders that can be inherited include schizophrenia, bipolar disorder, major depressive disorder, autism spectrum disorder, attention deficit hyperactivity disorder (ADHD). Genetic factors that contribute to the development of mental disorders include epigenetic regulation and genetic polymorphism. Epigenetic regulation affects how a person reacts to the environment and whether they will experience mental disorders as a result of that reaction. Genetic polymorphism is related to changes in DNA that can make a person unique as an individual. However, the combination of specific genetic polymorphisms with specific environmental factors can lead to the development of mental disorders. Although mental disorders can be inherited, the severity of symptoms can vary among family members. Genetic testing for diagnosing mental disorders is not available because experiences and the environment also play a significant role in the causes of mental disorders. If you have a family history of mental disorders, it is important to understand the signs and manage your own mental health. If you have concerns about your child, understanding the signs of mental disorders in children and consulting with a psychologist or psychiatrist can help provide the appropriate assessment and treatment. 2. Environmental factors. Social, cultural, and everyday life environments can affect a person's mental health. For example, chronic stress, trauma, or significant loss can contribute to mental health problems. Here are some environmental factors that can affect mental health. Aesthetics. Aesthetic factors are related to how a person arranges their living space. Too many belongings or excessive visual distractions can make a person feel overwhelmed and affect their mental health. Social and cultural factors. Social and cultural environments can also affect a person's mental health. Factors such as social stratification, social interactions, and cultural norms can impact mental health. Physical factors. The physical environment of a living space, such as cleanliness, noise, and air pollution, can affect a person's mental health. An unhealthy or uncomfortable environment can increase the risk of mental health problems. Social support. Social support from family, friends, and the community is also an important environmental factor in maintaining mental health. Lack of social support can increase the risk of mental health problems. Stress. An environment filled with stress, such as high work pressure, interpersonal conflicts, or trauma, can affect a person's mental health. Chronic stress can lead to mental health disorders. Access to mental health services. An environment that allows easy and affordable access to mental health services is also important in maintaining mental health. The availability of quality mental health facilities can help individuals overcome mental health problems. It is important to create an environment that supports mental health, both through changes in the physical and social environment. If you or someone you know is experiencing mental health problems, it is important to seek professional help and create an environment that supports recovery. 3. Biological factors. Chemical imbalances in the brain or certain neurological disorders can play a role in the development of mental health problems. Biological factors play a significant role in a person's mental health. Some biological factors that can affect mental health include brain. The brain is an organ that controls human activities and plays a role in regulating mood, emotions, and cognitive functions. Chemical imbalances in the brain can cause mental health disorders. Endocrine system. The endocrine system regulates hormone production in the body. Hormonal imbalances, such as the stress hormone cortisol, can affect a person's mental health. Sensory factors. Sensory factors can also play a role in mental health. For example, hearing or vision impairments can affect a person's cognitive function and emotions. Maternal factors during pregnancy. The mother's condition during pregnancy, such as exposure to toxic substances or severe stress, can affect the development of the fetal brain and increase the risk of mental health problems later in life. These biological factors can interact with other environmental and psychological factors to affect a person's mental health. The impact of mental health disorders can vary from individual to individual. Some common impacts include 1. Emotional disorders. Emotional disorders are mental health conditions in which a person experiences significant changes in their mood and emotions. Emotional disorders can affect how a person feels, manages, and reacts to their emotions. Some examples of common emotional disorders include depression. Depression is a mood disorder characterized by prolonged feelings of sadness, loss of interest or pleasure in daily activities, changes in weight or appetite, sleep disturbances, fatigue, and thoughts of death or suicide. Anxiety. Anxiety is an emotional disorder characterized by excessive worrying, tension, and constant worrying. Symptoms of anxiety include restlessness, difficulty concentrating, muscle tension, sleep disturbances, and panic attacks. Bipolar disorder. Bipolar disorder is an emotional disorder characterized by extreme mood swings between manic episodes, periods of excessive excitement, high energy, and impulsivity, and depressive episodes, periods of deep sadness and loss of interest. Emotional disorders in children. Children can also experience emotional disorders, such as anxiety disorders in children, depression disorders in children, or behavior disorders related to emotions. Emotional disorders can have a significant impact on a person's daily life, including social relationships, work, and overall well-being. However, with the right help, emotional disorders can be managed and treated. Solutions to address emotional disorders include psychological therapy. Cognitive behavioral therapy, CBT, and talk therapy can help a person identify negative thought patterns and develop strategies to manage emotions in a healthy way. Medications. In some cases, doctors may prescribe medications, such as antidepressants or mood stabilizers, to help manage symptoms of emotional disorders. Social support. Seeking support from family, friends, or support groups can help reduce social isolation and provide emotional support. Healthy lifestyle. Establishing good sleep patterns, eating nutritious foods, exercising regularly, and managing stress can help improve emotional health. If you or someone you know is experiencing emotional disorders, it is highly recommended to seek professional help. Psychologists or psychiatrists can assist in the diagnosis and appropriate treatment based on individual needs. 2. Behavioral disorders. Behavioral disorders refer to patterns of behavior that are not in line with social norms or disrupt a person's daily life. Behavioral disorders can involve aggressive, impulsive, or uncontrollable behaviors that can cause problems in social relationships, education, or work. Some examples of common behavioral disorders include behavioral disorders in children, for example, attention deficit, hyperactivity disorder ADHD, conduct disorder, or oppositional defiant disorder. Conduct disorders. These involve behavior that goes against the law or social norms, such as destructive behavior, stealing, or violence. Eating disorders, for example, anorexia nervosa, bulimia nervosa, or other eating disorders involving unhealthy eating patterns. Impulse control disorders. These involve difficulty in controlling impulses or desires, such as impulse control disorder or obsessive-compulsive disorder. Substance use disorders. These involve excessive use of drugs or alcohol and can cause significant behavioral changes. The impact of behavioral disorders can vary depending on the type and severity. Some possible impacts may include social relationship problems. Behavioral disorders can lead to social isolation, conflicts with others, or difficulties in building and maintaining healthy relationships. Education problems. Behavioral disorders in children can disrupt learning abilities and participation in the school environment. Job problems. Behavioral disorders in adults can affect work performance, relationships with colleagues, or limit career opportunities. Legal problems. Some behavioral disorders may involve illegal behavior, which can lead to legal issues or other serious consequences. Solutions to address behavioral disorders depend on the type and severity. Some steps that can be taken include consultation with a mental health professional. Psychologists or psychiatrists can assist in the diagnosis and treatment of behavioral disorders. Behavioral therapy. Cognitive behavioral therapy or behavioral therapy can help individuals understand and change unhealthy behavior patterns. Family and social support. Support from family, friends, or support groups can help individuals overcome behavioral disorders and build healthier skills. Supportive environment. Creating a stable, structured, and supportive environment can help individuals with behavioral disorders better manage their behavior. It is important to seek professional help if you or someone you know is experiencing behavioral disorders. Mental health professionals can provide appropriate assistance and help individuals achieve better health and well-being. Physical disorders. Physical disorders can refer to various health problems that affect the body physically. Some examples of physical disorders include chronic diseases like diabetes, hypertension, heart disease, or cancer are examples of chronic diseases that can affect a person's physical health in the long term. Physical injuries like broken bones, burns, head injuries, or sports injuries can disrupt physical health and require medical treatment. Neurological disorders like stroke, epilepsy, multiple sclerosis, or Parkinson's can affect nerve function and a person's physical health. Musculoskeletal disorders like osteoarthritis, osteoporosis, or scoliosis can affect bones, joints, and muscles and can cause pain and physical limitations. Respiratory diseases like asthma, chronic obstructive pulmonary disease COPD, or sleep apnea can affect respiratory function and disrupt physical health. The impact of physical disorders can vary depending on the type and severity. Some possible impacts include pain and discomfort. Physical disorders often cause pain or discomfort that can affect a person's quality of life. Physical limitations. Some physical disorders can cause limitations in movement or daily activities, which can affect a person's independence and mobility. Emotional disturbances. Serious physical disorders can affect a person's emotional well-being, such as depression, anxiety, or stress. Social impact. Physical disorders that are visibly apparent can affect social interactions and a person's daily life, such as difficulty in communication or feeling isolated. To address physical disorders, it is important to seek medical help and follow the recommended treatment by healthcare professionals. Physical therapy, medications, lifestyle changes, or surgical interventions may be necessary depending on the type and severity of the physical disorder. Additionally, social support from family, friends, or support groups can also play a crucial role in helping someone cope with the physical and emotional impacts of physical disorders. It is important to remember that each individual has unique needs, so the right solutions may vary for each person. If you or someone you know is experiencing mental health issues, it is highly recommended to seek professional help. Thank you for watching this video, and I apologize for any mistakes in sentences, language, or pronunciation. Thank you. Don't forget to subscribe, like, and share. And please share your thoughts in the comment section. See you.